Good afternoon. Welcome to Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center and United Medical ACO. I'm here with Dr. Isaias Ergau. Dr. Ergau, how are you doing?
I'm doing great, Kemal. As usual, it's great to be back on another Bariatric Friday. I will take this opportunity to reintroduce myself just for people who haven't watched many of our recent events. Again, my name is Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is weight loss surgery or bariatric surgery. And I have been performing bariatric surgery now for over 20 years. And with my colleagues at CHRIAS, we're by far the most experienced group in bariatric surgery in our area. We've actually established centers of excellence for bariatric surgery in many of the area's main health systems. And if we've introduced a number of the newer bariatric surgeries to our areas as well.
So, bariatric surgery, for those patients who are going through the bariatric surgery or patients who are not decided, but they may, not patients necessarily, those individuals who are struggling with morbid obesity and may want to go through the surgery, as the surgery being the most efficient way of fighting morbid obesity. We are here, and we want to be a resource to those individuals, and also we believe that there is a social responsibility that Dr. Erkan and myself we have to take. The reason I'm saying that is because every day there's some anecdote that I have that's telling me that people. Professionals in healthcare, others, they still don't understand the morbid obesity. So Dr. Guy, yesterday I have a meeting with one of the insurance companies, I won't mention the name, and same issue, like patient comes to you as for a bariatric consult, and then the guy goes, but why did you decide to make the decision of the surgery at that visit? I'm like, because my surgeons are bariatric surgeons and patient is morbidly obese. So I'm not a cardiologist. So I'm not going to actually do cardiology clearance. So I'm telling you that this is the most efficient way to fight morbid obesity and most efficient treatment. And I thought he was a coder. And, you and I, we didn't, I know people who follow us closely, they trust us when I say what it is. You and I, we didn't talk about this, and you didn't know that I was going to tell you about this. And in fact, I didn't know that I was going to tell you about this until maybe 30 minutes ago. Mm-hmm. So there were 12 other people. The meeting is recorded. And then I'm like, later on, I asked the people because they left, and then another group from their company, they stay, and then I said, who was that guy? And they said, Dr. So-and-so. I'm like, so that question came from a doctor. Wow. Who's in charge of your medical record. And I'm like, we are in trouble. Yeah. If the doctor is asking me, how do we even make that decision at the time of consult? I'm like maybe just shake it a little bit and then maybe it will work. Like, in the old phone booths, like you would beat them up and then they would start working. But what's wrong with you? What the hell is wrong with you? Telling the surgeon that they shouldn't make the surgery decisions. So what am I going to do with the BMI 54? What is the patient going to do with the BMI 54? And then it just makes this event even more important. Yeah, so, absolutely. Because we are not just promoting a service. I mean, our service is there, and we have enough patients. In fact, I was talking to Surgery Center yesterday, and trying to figure out patients because there are a lot of patients there. So it's not the number of patients that we want to reach out necessarily, but we want to reach out to people, even if they live in a different part of the country. Right. They can go to a bariatric surgeon in that state and then get the help, because people do not understand this problem. Right. They still don't. Now, yep. Today we are going to talk about another segment of the process is the smoking and alcohol before and after. So if you can actually, and I don't know if you want to take them one at a time or if you want to address them together, but I'll leave that up to you.
Absolutely. I think we can talk about them together for a bit and then address some of the issues separately because there are some important distinctions, of course. I can understand, of course, alcohol, right? Because, it is part of our society, it's part of our life. And, if it is done in moderation, it is fine, right? By any standard, in any situation. So the question coming up, can I drink alcohol? And, before my surgery, when should I stop drinking alcohol? Or after my surgery, am I allowed to drink alcohol? And if I am, when am I allowed to start? These are very reasonable questions, right? But on the other hand, smoking, you would think we shouldn't even be discussing this, right? Smoking should be banned, because the plethora of problems that are associated with smoking in our health have been so well established by now, right? And yet, of course, a lot of people still struggle with tobacco addiction, and a lot of people do smoke. And it's important for us to have to address that issue, not only in terms of the general health of the person, but also because there are some very, very pertinent issues related to smoking and bariatric surgery. So this session today is obviously very important. Let me start with smoking first, right? As I said, my answer would be no one should be smoking, right? Are you preparing for surgery? You should stop smoking. Why? Not only the general problems of smoking, but surgery, going under anesthesia, and as a smoker, having smoked cigarettes, the day before surgery, you're actually increasing the risk of complications of that surgery tremendously, right? The risks of anesthesia itself, the risks to the surgery itself are very, very high. So most surgeons, where they are preparing patients for elective surgery, which is surgery that is planned ahead of time, will really counsel their patients to stop smoking. When you are undergoing general anesthesia, it means that the control of your breathing, the control of many of the other systems within your body is actually going to be taken over by the anesthesiologist. The person will be asleep, right? Will not be feeling anything at all, right? So breathing particularly is something that the anesthesiologist will take over. They will have to put a breathing tube down the person's windpipe, and then there's a machine, a ventilator, which takes over the action of breathing. In a person who is a smoker, the lungs, the respiratory system is already at a huge disadvantage. So for a person to recover from that situation where a machine were making them breathing, really, it's going to be very difficult. For some patients, it may be so difficult that it may be very hard for them to come off the ventilator after the surgery. Other patients will have a hard time recovering from a respiratory point of view, and they will be at high risk for developing pneumonia, and people can die with a pneumonia after surgery. So the risks of surgery and smoking are very, very real. Not to mention the issues related to healing, right? When we are smokers, our ability to heal, to supply blood to the areas where our body needs it most, where it has to do the actual process of healing, is interfered with. So we may be at risk for infection. We may be at risk of wound disruption, right? So all those problems are real and they are related to smoking. So definitely we want our patients to stop smoking before major surgery.
Well,
but
so
go ahead.
Can we just pause a little bit? Again, for average person to understand this, like, can you just maybe, even if you did already say it, maybe say it in a different way so then everyone can understand what happens when we smoke?
Absolutely. So when we are smoking, Kemal, we are inhaling poison to our tissues, right? That actually, because the smoking is done by inhaling things, so it's our respiratory system which is directly affected first, that gets the most of the damage is in our respiratory system. So the windpipes, all those little pipes that start from our windpipe in our throat and go branching into our lungs, all those little pipes will be damaged. They will be super reactive. And then the actual lung tissue, which is extremely delicate, very, very delicate, because it has to be able to support the exchange of gases between our blood and our windpipes. That tissue that of the lungs gets damaged very, very easily. And obviously smoking, and we're talking about habitual smoking here, people who smoke on a daily basis, right, are really damaging their tissue on and off, right? The good thing, Kemal, is that the most amazing thing is that the ability for our tissues to recover is extraordinary. So if a person actually stops smoking, that damage not only stops, but our body is able to heal fairly quickly, so that a person who stops smoking for 4 weeks, for 6 weeks before surgery, they will be really in way much better shape than they were, before they stopped smoking from that point of view. And as we know, even the other damages of long-term smoking, the longer a patient has been since they've stopped smoking, the more likely it is that the person will get out from that danger. Even the danger of getting lung cancer actually can disappear over the years once a person stops smoking. So smoking directly damages our respiratory system, but obviously there are other damages that occur in the rest of our body as well.
So now, for those maybe who may be a smoker and they stopped smoking 4 months ago versus they stopped smoking 2 weeks before the surgery. So what's our approach on that case?
So again, the most important thing would be to stop for our practice. As you know, we say a month. They have to. If the patient is still smoking within that month, before surgery, we actually delay the surgery. We postpone it. It's very important for us. And I'm talking about somebody who continues to smoke on a daily basis here, right? And why is that? Well, we are talking about the fact that if there has been that 1 month, 6 weeks interval, the chances for recovery of their lungs and the rest of our tissues is going to be much higher, as opposed to the person who just stopped smoking a few days before surgery. So for bariatric surgery, we definitely have this stop. Now, why is it, let's go delve a little bit into bariatric surgery specifically here, Kemal, right? If a person resumes smoking after bariatric surgery, there is a huge danger of them having complications related to bariatric surgery, particularly with something like gastric bypass. When we do gastric bypass, Kemal, we actually create an artificial connection between the intestine and the stomach. That artificial connection heals by creating a scar, right? That connection itself is vulnerable to damage to that scar, to that connection, in the form of an ulcer. An ulcer is like an open wound, essentially. And that potential is a lot higher for somebody who's a smoker than a person who doesn't smoke. And when people develop ulcers after gastric bypass, first of all, their life is miserable because they will have pain continuously. They will have a lot of pain every time they eat or drink something, right? So there is that quality of life. But more importantly, Kemal, with ongoing smoking, that ulcer will not heal, no matter how much medication we throw at them, right? And there are complications of ulcers. Ulcers can burst. If an ulcer bursts, Kemal, unless surgery is undertaken emergently, that person can die. Or an ulcer can bleed, and the bleeding can be so rapid and so massive that a person could die of exsanguination in that case, right? So there are real life-threatening problems associated with ulcers after gastric bypass, for instance. And those risks are so much higher with smoking that it is critically important that anybody who's contemplating to have gastric bypass or they've had gastric bypass, they completely refrain from smoking, right? So if a person was a smoker, Kemal, and they've stopped smoking before a bariatric surgery, it is critically important that they stay quit afterwards, because as we know also, Kemal, tobacco is very addictive. So there is no such thing as, oh, I used to be a smoker, I feel like having a cigarette now. The minute they have that cigarette, the chances for them going back to the habit again are much higher. So it's important that there is total and complete abstention from smoking after bariatric surgery.
Exactly. So there are times that I'm wondering like how much of this is understood by patients. And you know, I can tell probably 25 to 30% of patients that are still smokers. So like when they start the process, and then you know the medical marijuana is also very common. Not medical is very common. Sometimes smoking is understood in a different way. So, you know, kind of the way that Bill Clinton answers questions. So, the definition of smoking is just a cigarette, or is it like, can I have other stuff? So, how is that limited with the? And I'm not trying to be advocate for anyone, so I'm just asking. So, can they have like medical marijuana like during that time, or is it the same?
So there is a differentiation. Definitely tobacco, nicotine, the problems I have mentioned are much better documented and known to us, right? Now, there is evidence now that inhaled marijuana could also cause ulceration and irritation to that connection that I talked about, although the data is not as strong as we have it for nicotine, right? There are patients who are not just from a recreational point of view, but medically prescribed, they take marijuana. So if they have to do that, my preference is for them to have edible medical marijuana as opposed to inhaled, because the problem is a lot larger when they are smokers as opposed to taking edible marijuana.
And then we are not suggesting that anyone should be doing it, but if they do, they should know what's expected. Now, let's go back to the alcohol.
Yeah, absolutely.
So moderation is something that is kind of like subjective, I guess. So moderation to you versus me may be different. What is that? And while you are actually explaining that, I'm going to just go there and get it. And don't ask me why I have a wine glass in my office, but I do. So I'm just going to get that and then just show it to people.
Absolutely, absolutely. So clearly, alcohol, right? In moderation, okay, we're fine, right? But when we are faced with excessive habitual drinking, that's where the damage can come as well, right? And there are certain specifics that are pertinent to bariatric surgery. First of all, let's start before surgery, right? Before surgery, people ask, you know, can I drink? When should I stop? I tell people, look, stop about 2 weeks before the surgery, right? Mm-hmm. Even, you know, moderate drinking. And the risk here is, you know, we don't want there to be interaction with medication, interaction with the medication that we will give them at the time of the surgery, because there could be interactions depending on when they have, you know, they drink alcohol. So the best policy would be to say, okay, you know, stop a couple of weeks before, and that's at essentially. Now we're talking about people who drink socially, moderately here. We're not talking about people who consume alcohol in excess, right?
Let's do the moderation, and it's water.
Yeah,
so,
yeah.
This is one glass, right?
So one glass, you're going to pour about, what, 6 ounces, maybe at the most 8 ounces?
Am I at moderation yet?
Yeah. So you will. that sounds like a 12 ounce right now, right?
So it's more than moderation, right?
That's way more than the moderation, of course. Yeah,
okay.
Yeah.
So,
and then we will touch up of the fact that, when it comes to life after bariatric surgery, moderation is even a lot smaller than that, because the effect of alcohol, as we will talk shortly, is a lot stronger, after bariatric surgery than before bariatric surgery, right? So
about now, are we?
Yeah, I think I can see that. That's actually like a reasonable portion, right? Like that's the normal 6 to 8 ounce
when
portion.
you go to a bar, if you ask for a glass of wine, if they give you this much, you would probably fight. So that's what we are trying to say. This moderation is really 6 ounces, right? So we are talking about, and this is maybe that. But normally when you go, you are expecting this. This is at least 3 times more than moderate.
Yeah, so we should be drinking water in that amount, not alcohol, right? So absolutely. So that's very important to understand, obviously, right? So we've talked about before surgery, stop 2 weeks before, and again, we're talking about people who drink socially and moderately. Now, if somebody has been identified as having an alcohol problem, in other words, somebody who's really drinking heavily on a nightly basis, heavy drinker on weekend, and so forth, it's very important that that issue is addressed before surgery, because in that case, we are bordering towards having a person who is struggling with alcoholism, and that has to be clearly understood, and that person needs to seek treatment, because the chances of them going back to heavy drinking after bariatric surgery are very high. They are in danger of going to that zone. And becoming a heavy drinker after bariatric surgery is a whole world of huge problems that that are way worse than a person that hasn't had bariatric surgery. And I will explain that in a minute, essentially. After bariatric surgery, even for moderate drinking, I tell people to wait 6 months, right? And that will give time for all the changes to occur within their physiology, that their GI tract is well healed. And then after that, they can introduce moderate drinking. Now, moderate drinking, again, is going to be a lot less than before bariatric surgery, because of the changes that have occurred in their digestive system. Now they're going to become drunk much more quickly. Their body is going to be a lot more sensitive to alcohol than it used to be. And so there is a danger for liver damage. Obviously, there is a danger to their gastrointestinal tract. They can develop ulcers much more quickly. And of course, alcohol obviously is empty calories. Not only they're going to be taking empty calories, but also it's an appetite stimulant, right? So they may end up eating way more than they should, which means that their whole goal of losing weight successfully can be sabotaged if they're drinking excessively, essentially, right? The other major issue, of course, is that if a person was struggling, for instance, with eating in association with stress or emotional issues, and now suddenly they cannot eat as much because physically their stomach is smaller and they cannot eat a lot, it is easy for that person to fall into things like alcohol, for instance, and become suddenly a heavy drinker, which is very, very dangerous. As I said, the chances of liver damage, the chance of them developing ulcers is very, very high. For them to become malnourished, for them to become dehydrated is very high, essentially. So
one serving is about 5 ounces. Wine is about 123 calories.
Yeah.
If it's whiskey, that's 70 calories. If it's beer, let's see, 110 is about 154.
Yeah. So it's a lot of empty calories come out, but more importantly, also, as I was saying, it just stimulates appetite. So people will continue munching and eating, as that happens, which means that their attempt to lose weight will be interfered with severely, right? But when it comes to alcohol, it's also important, now that you've talked about the different types of drinks, it's important also for us to clearly identify which drinks might be more acceptable and which may not after bariatric surgery. For instance, beer would not be acceptable because of the carbonation, and all carbonated liquids are a no-no after bariatric surgery. Now, mixed drinks very often come up mixed with very sugary things and juices, which means that the amount of calorie that they will have is actually a lot higher. It's not just the alcohol, it's just the sugar that comes with the mixed drinks. So I advise patients to avoid mixed drinks as well. Now, the drinks, heavy spirits with high alcohol level, also I would advise them to stay away from them, because the chances of them becoming drunk very, very quickly after they have a shot of something is much higher, but also the chance of them damaging their liver particularly is much higher with high alcohol content, right? So a drink that I would want people to settle with, but obviously, people have their own taste, is red wine, right? Wine if they can, right? So if they really have and want to have a drink, red wine would be acceptable, again, in moderation, again, after several months have passed after bariatric surgery. Now, a question that comes up very often, Kemal, is, and patients will tell you, oh, I tried this drink now. I'm a year after bariatric surgery, and I just barely had a couple of sips, and I already felt the effect. Well, the reason for that, Kemal, is because now the stomach after bariatric surgery is so much smaller, and its capacity to act as a buffer, as holding on to the alcohol and slowly releasing it to the rest of the intestine and therefore to the liver, is much, much, much smaller, which means that as soon as a person drinks, it immediately enters their system, and before they know it, it's in their brain, essentially, right? So the gastrointestinal tract, the digestive tract after bariatric surgery has been altered to the extent that a person will feel the effect of alcohol with much smaller amount, a lot faster than they did before bariatric surgery. So,
and because we always talk about, like I was just checking the activities, what we have to kind of realize, we have to come to the understanding of, okay, look, there's a problem here. And even if you don't have that problem with the morbid obesity, we all have these issues maintaining our weight. So once it gets to the point of maintaining, if you remember that patient that we discussed this week, she lost 95 pounds in 6 months.
Yeah.
And then something happened, and then she went up by like 20, 25 pounds. And immediately primary care physician, actually, they did pick up on that. And then I look at the appointments that they have with us. They had 2 no-shows. Now, because 95 pounds is a lot of pounds to lose in 6 months. So then she was so happy, probably. She's like, why do I need to go back? Well, you don't need to come back for another surgery. You just need to come back to learn more about the maintaining the weight loss, and just have the reminders, because there's a commitment issue that sometimes I see. Like the only reason we would be talking about alcohol at this point is because, well, this is already bad for all of us. So, and if you are dealing with this and you went through the surgery, that means this is already maybe part of the reason that you are there to begin with. So.
Yes.
You don't need to justify why you shouldn't be doing smoking or alcohol, because you shouldn't be doing that even if you didn't have morbid obesity, period. Yes. So that's the part that is always being missed. Like, oh, now, poor me, I'm, I have to go through surgery and I have to quit alcohol. No, you should just not drink. And because if you and I, if we drink every day, we are going to gain a lot of weight, right? So this is that's simple.
Absolutely.
That's simple.
Absolutely.
So that's the part that needs to be really registered well, so that there is the commitment part of it to make this successful. So we always say that this is not a magic. Surgery itself is a huge tool that's going to help us to get there. But the understanding of the changes that we need to make this less complicated is important. So patient mentality needs to be there. So then, okay, I have to do X, Y, Z to make this permanent and more successful. That's kind of like where we are with this issue, right, Dr. Irgau?
Absolutely. Yeah. In terms of smoking, there is one thing I would like to add there, Kemal, and that is, first of all, many patients who are smokers and come for bariatric surgery, when we tell them about the requirement for them to stop smoking, one of the things they bring about is, oh, if I stop smoking, I will gain weight. Well, that is actually true. That is true, right? There will be some weight regain because smoking does act as, somehow of the appetite suppressant, at least for some people, and they feel that as soon as they stop smoking, they will see some bump in their weight. Well, we can deal with that, and we can, we would gladly accept some weight gain that we can address through the nutritional preparation that we have before surgery, or sort of special diet that we put them before surgery, rather than having a person, continue smoking, of course. So that is one issue. And then sometimes I hear this myth that people think that after bariatric surgery, smoking might prevent weight regain. There is actually no data to suggest this, Kemal, right? So smoking is just associated with a plethora of problems and no benefit at all after bariatric surgery. So it's important to for people to clearly understand that. Now, if you really think about it, from my point of view, a patient who struggles with morbid obesity and perhaps diabetes, high blood pressure and heart disease, and they are a smoker at the same time, it's like adding, more fuel to fire, really, because there is no worse combination than having diabetes, heart disease, and smoking, right? And yet, if that person enters our program in that situation and then comes out without obesity, without diabetes, and most importantly, they have quit smoking, they have completely transformed their trajectory, right? Yeah. They have changed where they were heading. They were heading probably to an early death with that combination of high weight, diabetes, heart disease, and smoking. Now, not only their weight is down, but they've stopped smoking as well, right? Suddenly, they've added so many more years to the prospects of their life and healthy life as well. So when I see a patient years after bariatric surgery with a healthy weight and they are an ex-smoker, Kemal, there is no, better gratification as a physician than seeing that, really.
The good news is the program is here for patients to take advantage of, even if they are at the point of they have issues with smoking and alcohol. When we start them with the program, throughout the process, we help them. We help them to go through that painful time. So that's kind of like, that's why we are doing this. So yes, there are difficulties, and it's something that's most people won't be able to do by themselves. Yeah. And then we build this great program with so many checks and balances to make sure that patients are getting the most help that they can. And, that's something that we are always proud of. And before it's too late, come and take advantage of what we have. Or again, if you are watching this in any other part of the world, this is, as long as it's done through a good certified accredited program, you are in good hands. So morbid obesity is a major chronic illness, and then we have to solve that problem. And then this is the bariatric surgery is the most efficient way to treat morbid obesity. So we'll be here again next week with another topic. Dr. Erkan, thank you so much for joining me. And
thank you, Kemal.